welcome to Trans for Doctors. Before we get started, I'm not a medical professional. I'll just be referring to the good work of other NHS doctors, as well as doctors worldwide, which are guidelines that are used by actual GICs and so forth. Now, as a medical professional, you will probably have to make that choice, whether to start someone on medication while they're waiting for the GIC or whatever. This is called a bridging prescription.
The GMC has released guidelines on when to prescribe bridging prescriptions, such as in the risk of self-harm, suicide, or self-medication, which I will explain later. One of the key things you need to remember is you need to figure out these risks proactively, instead of relying on the patient to tell you them.
Beware that hormones are not a requirement for transition. Some people may choose not to take them, and that's fine. Obviously, there's a bit of natural worry about doing this, as you may not be considered a gender specialist, and you might be wondering about the implications for your medical license. But you're actually best placed to make this call, as you'll be able to see the entire person, and you'll see the entire medical history, and you'll be able to make a objective call about this. And you are allowed to do this. There are some GPs who do this already. In some areas of different prescribing groups, it can be a little bit more complicated, as the medications are still on the amber list, as they've not been updated yet. The two things I'd advise you to follow: the NHS Charing Cross GIC guidelines and the WPATH guidelines for transgender care. These are really good gold standard guidelines for you to follow. The practical things you'll need to consider are blood work, which is simple but you need to do it, and also things like preserving gametes on the NHS. There are options, there are referrals you can make. Some people will choose to preserve the gametes, some will not. Please respect their choices. What I really need you to understand is that any treatment you give to someone, whether that's hormones, whether that's for mental health, physical health, and so on, you already know that the benefits must outweigh the side effects, and any doctor who's worth their salt will give a medication if they perceive that the benefit to the patient will be better than the side effects they may experience. This should not put you off prescribing hormones, because for some people it's genuinely life-changing, like for myself. Now, there is a bit of a dark side, as people will get desperate, they're waiting for years for GICs, and so they may turn to something called self-medication. Yes, it's as terrifying as it sounds. People are just buying drugs from foreign countries and either taking them or even sometimes taking injections of estrogen or testosterone or whatever. Do not let this happen. You need to practice harm reduction here. In terms of children and adolescents, it's a little more complicated. You'll probably end up doing things like puberty blockers, for example. However, puberty blockers are not new medications whatsoever. They are used in other things such as precocious puberty. We know what they do, we know the side effects are, so there's really no reason to be scared of them. The benefits of the treatment must outweigh the realistic risks of it, really. That's all there is to it. I'd like to remind you that if you ever get stuck on medication, call up Indigo. They'll tell you what to do. They've got wonderful trans-friendly doctors who will absolutely guide you in this process. If you're working with a GIC, you will have a shared care agreement with the GIC, so just call up the doctor and ask. That's it for medication. Next video, we'll talk about the bureaucratic hurdles we face under the NHS.